Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an informative and exciting show for you this evening. We'll be joined by a panel of medical experts from the field to discuss advances in orthopedics. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at advances in orthopedics with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Pat Brogel, an orthopedic surgeon. After completing an orthopedic fellowship at the Hospital of the University of Pennsylvania, Dr. Brogel joined the St. Luke's Network and settled into Saucon Valley with his wife. They've raised 4 children here. During the past 21 years, he's become invested in the community, and he's enjoyed treating generations of family members. He and his wife enjoy golf and attending Iron Pigs games, as well as live music events. Wherever they go, they see patients, which he says is fantastic. And I'm one of those patients, so thanks for being here, Dr. Brogel.
Well, thanks for having me, Ash. Appreciate the invite.
Tell me a little bit about how you got interested in the field of orthopedics and what you find most rewarding about the work that you do.
The interest in the field of orthopedics really began in med school. Spending time in a busy county hospital, Kings County, you look around and try to identify who's having the most fun while at work. And clearly the boys in blue, the orthopedic guys, were absolutely the busiest service in the hospital, but clearly having the most fun. So I began to gravitate over to those guys, and really they introduced me to the field of orthopedics. And since my introduction, it's really been nothing but been the most rewarding career I could ever imagine.
I know that you have a lot of fun at work, but you're also super capable and an amazing physician. So thank you for joining us tonight. Joining our panel next is Dr. Chinenye Nwachukwu, a board-certified orthopedic surgeon who specializes in trauma as well as hip and knee replacements. He treats various musculoskeletal conditions, including arthritis and other degenerative diseases that affect our joints. Among other things, Dr. Nwachukwu also cares for traumatic injuries, which may result from accidents and falls. He's also involved in research and educating the network's residents and medical students. Dr. Nwachukwu uses robotic technology to precisely locate and replace joints with minimal harm to the surrounding tissue. This technology, combined with implants customized for the patient, results in less blood loss and fewer complications during surgery, reduced risk of infection, smaller scars, and quicker recovery. Dr. Nwachukwu, thank you for being here.
Thank you, Ashley. Thanks for having me.
I know that you do a lot of teaching at St. Luke's. Can you tell me a little bit about what it is you find rewarding about teaching and why you think it's important to keeping you kind of on your toes as an orthopedist?
I think, again, anytime you can kind of give back to a younger generation that is going to, participate in the field of orthopedics, I think it's, first of all, amazing. And I think it's a blessing just to even have that option. Get a chance to teach some of the strongest, smartest, hardest working residents. And, it's always a great thing to see that these people actually go ahead and take care of patients who have some of these orthopedic pathologies. Anytime you can get to influence somebody to go into the field of medicine, hopefully orthopedics, being a part of that training is always a blessing. And again, like you said before, to keep you on your toes. Sometimes they ask you these questions that, you may not even have an answer to, and you don't want to answer it with a 2,000 answer. You want to make sure that you're up to date. So you always continue to research so that you can at least have some up-to-date answers for them. So again, I love teaching.
Thanks, Dr. Nwachukwu. Great information. Let's meet our final panelist, Dr. Adam Sadler, a board-certified orthopedic surgeon at St. Luke's. Before joining the network in 2016, Dr. Sadler completed a fellowship in joint replacement, revision surgery, and robotic joint replacement at the Florida Orthopedic Institute in Tampa, Florida. Dr. Sadler treats a variety of musculoskeletal conditions and has a subspecialty that provides treatment to adults with hip and knee osteoarthritis, post-traumatic arthritis, and deformity and avascular necrosis. He performs total and partial joint replacement procedures, revision total joint replacement, and complex reconstruction procedures. Dr. Sadler is also proud to be the network director of the Orthopedic Robotics Program and the director of adult reconstruction at the St. Luke's Warren campus. Dr. Sadler, thank you so much for joining us.
Sure, thank you for the invite. Happy to be here.
Tell me what it is you love about the field of orthopedic surgery and why you feel it's so important to really connect with your patients to figure out the best treatment option for them.
What I really enjoy most about our profession and being an orthopedic surgeon is to be able to have a direct impact on a patient's quality of life, health, activity level. We find that with orthopedic disease, it often deteriorates people's quality of life, function, activity, all the things that bring them joy. And to be able to have a direct impact on maybe restoring that for them really is what brings me the most satisfaction. I think when you look at people and their treatment plans, and I think it's really important to individualize their care because every patient is different. Every patient has a different goal for their treatment. Every patient has a different desire for their recovery or for their end activity level. So being able to integrate their desires, their goals into their treatment plan really helps make their process more successful and makes them feel as though they're playing a role in their recovery and their treatment as well.
It's a great point. I really appreciate you bringing up the idea that each patient really has a role in their recovery because I think that's so important. So thank you all so much for being here. Thank you all so much for giving us a little insight and background information into your expertise and interest in orthopedics. Next, we're going to dig deeper and talk about basic orthopedic care at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
I first started noticing pain in my hip early in this year. I thought I maybe pulled something, but it just progressively got worse pretty quickly to the point where I was limping. That took me to the doctor initially. I made an appointment with ortho. They suggested that I have an injection to see if that relieved anything. So I set that up, did that injection. I had beautiful relief, but it only lasted 2 weeks. In the meanwhile, I learned Dr. Wachuku was a doctor who did anterior versus posterior, which I was really interested in because recovery time is shorter, and that's what led me to Dr. Wachuku. Everybody at ortho from A to Z was extremely, extremely helpful. And I was physically out of the hospital shortly after lunchtime on the very next day. I am walking outside. I've been walking outside for 2 miles, probably within about 2 weeks post-surgery. My surgery has changed my life because I felt like it was going to make me feel old. I felt like it was going to slow my lifestyle down. It hasn't really changed my life that much. It's actually better because I'm doing that pain-free now. St. Luke's Ortho and St. Luke's PT has really helped me get back on my feet pain-free.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program tonight and for providing us with questions for our panel before the show. We'll get to those in a little bit. Joining me is a talented panel of medical professionals, Dr. Brogel, Dr. Wachuku, and Dr. Sadler. We've started to discuss everyone's background and their expertise in this field. Now let's talk about the basics of orthopedic care at St. Luke's. All right, Dr. Brogel, I'm going to get started with you. Can you tell us what are some of the most common orthopedic issues that you see, and what's your philosophy of care?
If you think about your traditional orthopedic surgeon, for generations, Ash, they've been thought of as bone and joint surgeons. And if you throw into that other aspects of musculoskeletal medicine, muscle and tendon problems, you kind of have my practice in a nutshell. We take care of sore joints. I take care of worn out joints. I take care of sore muscles and tendons. I take care of ruptured muscles and tendons. And finally, the field of orthopedics wouldn't be complete unless I took care of common orthopedic injuries, fractures. I'm more of a general orthopedic surgeon who enjoys taking care of complicated fractures, as well as enjoys doing a variety of surgeries, including but not limited to hip and knee replacements. So we try to take care of everything.
Well, it's good for people to know that no matter what their orthopedic need is, if they come to see you or the group at St. Luke's, they will find the right care. Dr. Wachuku, I know that you have a passion for international medicine and that you've traveled abroad as part of the St. Luke's International Studies program. Why is that work so important and what has it taught you?
I've always been interested in global medicine. I just didn't know it was going to be in orthopedics. But once I got into orthopedics, my best friend and I, we always wanted to make sure that we traveled to sub-Saharan Africa to do some sort of work. When I came to St. Luke's, this program, which was really spearheaded by Dr. Richard Sharp, he was able to invite me to trip that they went to in Cameroon a few years ago, went for a couple of weeks, and we were able to really kind of work with the healthcare system over there, learn from them, because again, it was really more of a, we learn from them, we teach them also. So it was really reciprocal in that nature. I've also continued to work in international medicine, kind of going to Ghana. Of course, COVID kind of slowed things down. But again, it's one of those things where you learn so much, not only some of the pathologies that you may not see in America or in this, what we call the high income countries, but you actually learn also how to be efficient, how to use implants. Anytime you can go to a place and you can learn and also be a teacher, I think is a win-win.
And like you said, you may not have everything at your fingertips that we're used to having here at St. Luke's, and that's an important skill to develop in physicians. So thank you for the work that you do in that field. Dr. Sadler, I know that there is a cut last approach, and sometimes people hear the word surgeon and they assume all you want to do is cut somebody open and do surgery, but often a conservative approach works best. Why do you believe in this?
It goes back to what we try to establish as the patient's goals for treatment. And we like to move in a conservative fashion, utilizing the resources that we have to try and treat their issues with the least invasive manners possible. Because I think you're right, when people come to a surgeon, they expect to hear those words, you need surgery. And oftentimes it could be things that could be treated with an anti-inflammatory regimen, physical therapy, less invasive options, weight loss, lifestyle modification, brace wear. When we need to escalate the care, we will, but we always like to start as conservative as possible to try to get the maximum benefit out of the least invasive treatment options possible.
Which is really good news for patients. And I'm going to turn the conversation back to you, Dr. Brogel, because you mentioned seeing people for a variety of reasons. And maybe someone's concerned about coming in because they are concerned about surgery needing to happen. So can you tell us a little bit about what your approach is when a patient first comes in, and what are some common things that you see or might try before you go the surgical route?
When people come to me, they get individual care. You know, if I receive someone, first-time patient, who's exhausted every treatment known to mankind, sure, they're at the end of the rainbow. We consider surgery, but we always take a step-by-step approach towards managing patients. Clearly, we start with the least aggressive, and then we work our way to more advanced and more aggressive techniques. So the treatment is individual. My old chairman was a big fan of the term, treat the patient, not his x-ray. So we treat patients rather than the imaging studies that they present with us. And if patients present us with a problem that we can solve with simple techniques, that's the pathway we take.
I remember I had a pediatrician when I first had my son who said the exact same thing, which is treat the child, right? If they're eating, they're sleeping, don't be too concerned. So I think that that's a great way to look at it. You know, Dr. Wachuku, hip pain is so common. People have it all the time. It's a big concern that people think if they come in, they're going to have to get a hip replacement. So what can be done for people with hip pain, and when do you know that a replacement is the way that you've got to go?
You know, every time somebody thinks about hip pain, you know, you may think hip replacement, but again, there's so many things that can cause hip pain. One of the things that Dr. Brogel mentioned before, it could be muscle pain, something around the hip. It could be tendonitis. It could be bursitis. There's so many other things that can cause hip pain. The primary care physicians are usually the first ones to see these patients, and they try to work them up. But when we see them afterwards, when they refer these patients to us, we try to figure out exactly what the cause of the hip pain is. Let's say it happens to be arthritis. Well, just as Dr. Salas stated, we want to try all the conservative measures, you know, lifestyle changes, maybe, you know, anti-inflammatory medications if there's no contraindications. So you want to make sure that you do everything possible to get them some sort of treatment. If that doesn't work and we've done the workup and we know that, you know what, this person may have some sort of arthritic change, maybe due to rheumatoid arthritis, then we start talking to them about, you know what, these are the pros and cons of conservative and possibly operative interventions such as a total hip replacement.
Many hip issues, but Dr. Sadler, you also see a lot of knees. You hear people complaining about that knee pain all the time. When do you know what to do with a patient? So they come in with knee pain, it's so common. And again, that fear possibly of a replacement. What are the options in between, and when do you know it's the right time to do surgery?
We want to make sure that we address all the conservative options first. So things that we can do ahead of time, anti-inflammatory medications, brace wear, physical therapy, lifestyle modifications, like my colleagues mentioned. So when we see the things that cause arthritis, we have to determine the cause. We've hit on some of those: rheumatoid arthritis, osteoarthritis, prior injury, prior trauma, prior surgery, but there's also lifestyle choices. There's also genetic variability that can cause the onset of knee pain and arthritis. So once we've identified a cause, identified a conservative treatment approach to them, we start seeing how they're responding to that. And at the point when they stop responding to conservative measures of treatment and their pain continues to persist, their quality of life continues to decline, that's when we start to think about a surgical intervention. But it's not until that point that we kind of put away the conservative measures and start talking about surgery.
Such insightful information from all of our panelists, but we're not done yet. After the break, we'll learn more about advances in orthopedic technology. Stay tuned. You're watching St. Luke's Health Now.
Knee pain has probably started 30 years ago, 40 years ago. It's arthritis. I've dealt with it for a long time, obviously not as bad as it had been the last few years. I went to see a surgeon and they recommended surgery. I wanted to see if the knee could be done robotically. And a friend of ours had Dr. Sadler last year, and my primary care physician highly recommended St. Luke's orthopedic team. That's what led me to Dr. Sadler. He was thorough, didn't hold anything back. And one hesitation he had was my age, but talking to me and hearing about my past history, that I was a good candidate for it. The care team at St. Luke's was terrific. They really were. They were professional, they were courteous, and they just made sure that I was well taken care of. After surgery, within a day, the medication just took care of everything. He had soreness, but not real pain. In the months to come, I'm just looking forward to being able to walk. Overall, it was a wonderful experience. And if I know anybody who needs knee surgery, I'm certainly going to recommend the St. Luke's team, especially Dr. Sadler.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an intriguing show for you tonight. We're talking about advances in orthopedics. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Brogel, Dr. Wachuku, and Dr. Sadler. Thank you all for being here. In the first part of the program, we talked about your backgrounds in the field and the basics of orthopedics. Now let's dive into some exciting technological treatment options. Dr. Brogel, I'd like to start with you. Tell us about surgical optimization protocol that St. Luke's practices. What is that and how does it help patients?
If you think about what you want from the car you get in and drive every day, Ash, you want optimal performance, right? We want the same from our patients when we embark on this whole surgical treatment that's going to cost them 3 months of hard work. St. Luke's has looked at a number of studies and they realized that optimal performance from patients is going to be more easily achieved with patient optimization before surgery. Making sure diabetics have optimal control of their blood glucose, making sure people have respectable hemoglobin levels so they can tolerate the recoveries. And all things like that are designed to reduce complications and to make for enhanced patient recoveries. It's really done for the patients and maximizing their improvement more so than any other condition.
Dr. Wachuku, I know that there are several ways to perform a hip replacement surgery. So what's the difference between a traditional surgery and an anterior hip approach? And who's each one for? Who's it appropriate for?
First and foremost, anytime you're talking about a hip replacement, the main thing is that we're trying to get the optimum outcome for the patient. We want to make sure that we have the implants in the appropriate alignment. We want to make sure that first and foremost, before we do anything, we talk to the patient about the pros and cons of each approach. When people talk about the traditional approach, they're usually talking about the posterior approach. But again, the anterior approach has been around for many years. As far as what's the difference to anterior approach, one of the things that we try to do is, instead of going through the muscles, we try to go through the plane so that we're not really violating the muscle itself as much as possible. From an anterior approach, the hip dislocation precautions may be a little bit different as far as, you may not need an abduction pillow, some of the things that you may need for a different approach. Everybody trying to get the best outcome for the patient, it depends on what type of surgery, what type of body habitus the patient has. That may lead us to say, we'll go a posterior approach or anterior approach. at the end of the day, I know I keep reiterating this fact, within 6 to 8 weeks or so, whether you do anterior or posterior, usually patients kind of end up doing, about the same. But again, it's just making sure you find the right patient for the right approach.
And it is that personalized approach for the whole patient. So I really appreciate you sharing that. Dr. Sadler, you're the robot guy. St. Luke's, you're the first in PA and New Jersey to acquire the next generation robotic technology for knee replacements. So tell us, why is this technology a game changer?
It's been a really exciting season. We acquired the next generation robotic assisted knee replacement system that was just released in January. Robotic surgery has been around for probably more than 15, maybe 15, 16 years. And it's gone through multiple generations of performance. This one that we acquired is the newest generation to hit the market and has a lot of pros compared to some maybe older systems out there performing elsewhere. So what's nice about this is it takes real-time data from the surgery itself that takes the patient's anatomy, patient's disease, and allows us to formulate a plan right there within surgery that allows us to produce a customizable and personable implant and procedure for the patient. Now, we can use patient's anatomy and adjust certain things to make sure that we're performing the surgery within certain boundaries, but it allows us to reproduce our plan with incredible accuracy. We as orthopedic surgeons have done a very good job over the generations at becoming very good and facile at doing total knee replacements. This type of technology allows us to push that envelope a little bit further and become more precise and more accurate, again, moving the needle to better the outcomes for our patients. It's really exciting.
And really, it's the stuff that movies were made of, right? Back when we were growing up. And it's amazing that you're right in there doing it every day. Dr. Brogel, the advancements in orthopedics have really helped with patient outcomes, quality, and care. Why is this so important? Why does it matter about these outcomes?
Because that's the driving force in orthopedics. We always want to improve upon patient care, give our patients the care that results in maximum improvement with the least potential for downsides and complications.
Well, that's what everybody wants, right? You want to get back to your life as soon as possible. And I think that St. Luke's really allows for that. Dr. Nwachukwu, you have a new hip navigation technology. Tell us what this technology is. Why is it so beneficial when it comes to hip replacement surgery?
As far as this new technology, is a technology that I use for my anterior total hip arthroplasty. The reason why it's so important for me when I utilize it is it actually helps speed up the process. One thing we're often talking about is making sure we provide great outcomes for our patients. And we're utilizing this hip navigation system. We're able to, one, get real-time data as far as what the positioning of our implants are. Again, total hip replacement, we're doing with a ball and cup joint. So we want to make sure that the cup is in the appropriate position. It helps decrease the chance of patients having any kind of complications like dislocations. But at the same time, it allows us to also check one of the things that is a complication sometimes in hip replacements, which is our leg length discrepancies. And we're able to, in real time, actually figure out what the length of that limb is compared to what it started with. But again, getting real-time feedback and being able to adjust accordingly allows us to basically get better outcomes for our patients.
And it's all about the outcomes, right? This seems to be the theme for sure. Dr. Sadler, speaking of outcomes, what can a patient expect following a knee replacement with this advanced robotic system? I remember my dad getting a knee replacement 20 years ago and having weeks in a rehab facility, and a couple years ago being up that same day. So it certainly has come a long way.
We've progressed a long way from how we used to look at knee replacement and joint replacement in general to where we are today. And the robot adds the next kind of generation of progression and advancement. The patients have less postoperative pain because we're not manipulating the soft tissues as much during the surgery. Patients are able to recover quicker through physical therapy because their pain is less and their motion is optimized. And patients are returning to function much quicker than conventional knee replacements. I'm happy to say thus far, since we've integrated this technology, we are seeing that come to life in our office. Our patients are requiring less pain medications postoperatively. They're using assistive devices for less time after surgery, and they're progressing through physical therapy much quicker. So it's really exciting to see what the proposed benefits of this robotic technology, to see it come to life in the office and see the satisfaction that we're seeing in our patients. It's really exciting.
Thank you all for sharing these exciting advancements to help orthopedic patients. It really is incredible. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's Orthopedic Care, you can trust us with your hands, feet, shoulders, hips, and knees. Because healthy bones and joints mean you can do more. You can trust us to recommend the right approach to care, including joint-sparing treatments and therapies. And when surgery is the only choice, we offer options to help you heal faster, including technology-assisted joint replacements and muscle-sparing hip surgery. St. Luke's, the orthopedic care you trust, now more than ever.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about advancements in orthopedics at St. Luke's. Now we're going to read some questions from our viewers. Are you ready? All right, Dr. Brogel, I'm going to start with you. This audience member asks, I've been a runner for about 30 years and I'm now starting to feel it in my knees. What would you recommend as my first option to deal with the pain, and when do I think about surgery?
Despite the love for running and his desire to run, reduction in impact is going to be one of the easiest ways for this patient to change the pattern of knee pain that he has. I try to encourage people to do things like ride an exercise bike, ride a bike through your community, swim. Those are all fantastic ways to maintain a high activity level while promoting less impact and less potential destruction of the weight-bearing joints in the lower extremity.
All right, Dr. Sadler, I think this is a good one for you. This viewer writes, I have diabetes. Does that put me at a greater risk for orthopedic surgery?
When you look at diabetes as a whole, the answer is no. It really comes down to how well controlled that diabetes is. So if you look at things that we use to monitor the diabetic control, if the hemoglobin A1C indicates that the diabetes is not tightly controlled, yes, then you do become a risk for surgical intervention, and that could lead to complications like infection, wound healing problems, and other issues. So it's not just that if diabetes is present, it's about, is it controlled? Is it well managed? Is it tightly controlled? Those things all play a role in your risk stratification for surgery.
All right, this next one, Dr. Wachuku, I think was addressed to you. I've been living with constant hip pain for about a year. It's now interfering with my sleep at night. Is it time to consider hip replacement surgery, and how long is that recovery?
So we have to figure out and diagnose what the cause of the hip pain is. If it's due to arthritis, one of the things that we try to do is, again, try conservative treatment, try lifestyle modifications. If it is due to arthritis, we've tried all these conservative measures. Doing a total hip is definitely an option. Whether you go posterior, anterior, it depends on the patient, the body habits, things of that nature. But we try to get you back to your level of function, hopefully within 6 to 12 weeks.
All right, Dr. Sadler, this audience member writes, what activities can I still do following hip or knee replacement, and what should I avoid?
We like to look at impact versus non-impact, right? So people that have a hip replacement or knee replacement, they should avoid repetitive high-impact activities like running or jogging. We want to encourage things that are less impact, whether it be playing golf, low, moderate level hiking. These are all things that I explain to my patients that are perfectly okay. It's all things in moderation. We also recommend maybe avoiding heavy lifting on a repetitive basis. Again, all things in moderation are tolerable.
Thank you to our amazing panel for such great information, and to all of you for tuning in. For more information on orthopedic care at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.